Heart disease in women. Early warning, symptoms, causes. Heart disease is a name for several abnormal conditions of the heart and blood vessels. These include coronary artery disease, blockages in the blood vessels around the heart; peripheral artery disease, blockages in the blood vessels in the arms or legs; problems with your heart's rhythm, arrhythmia; problems with your heart's muscles or valves, valvular heart disease; congestive heart failure, problem with the pumping or relaxation functions of the heart muscle. These issues may develop over time or may be a result of abnormal formation of the heart in utero, before birth, called congenital heart disease. Heart disease is also called cardiovascular disease. It's often thought of as a health problem that mostly affects men. However, it's the leading cause of death for women in the United States, responsible for about 1 in 4 female deaths each year. Approximately 6% of U.S. women over age 20 have coronary heart disease or coronary artery disease, which is the most common type. The risk of heart disease increases with age. Early signs of heart disease. Many women don't have any symptoms of heart disease until they have an emergency such as a heart attack. However, if you do have early symptoms, they may include chest pain or discomfort, which can be either sharp or dull and heavy, called angina; pain in your neck, jaw, or throat; pain in your upper abdomen, upper back pain; nausea, fatigue, shortness of breath, general weakness; changes in skin color, such as grayish skin, sweating. These symptoms may occur either while you're at rest or during activities of daily life. Other heart disease symptoms in women. More symptoms may become apparent as heart disease progresses. Symptoms can differ depending on what specific type of heart disease you have. The symptoms of heart disease in women are also different than in men, who are more likely to have chest pain. Potential later symptoms of heart disease in women include swelling in your legs, feet, or ankles, weight gain, problems sleeping, your heart feeling like it's beating very fast, heart palpitations, coughing, wheezing, sweating, lightheadedness, indigestion, heartburn, anxiety, fainting. Risk factors for heart disease. Some types of heart disease are congenital, which means they're a result of anatomical abnormalities in the way the heart was formed. Genetic factors can also influence the chance of developing heart disease. Others can develop regardless of risk factors. However, there are many other conditions and lifestyle factors that can put you at a higher risk of developing heart disease. These include diabetes, high blood pressure, hypertension, depression, smoking, chronic stress, family history of heart disease, inflammatory diseases like rheumatoid arthritis and lupus, HIV, menopause or premature menopause, not exercising, having high blood pressure or diabetes during pregnancy, having overweight or obesity. There are also a number of conditions and issues for which having heart disease puts you at risk, including heart attack, stroke, heart failure, cardiac arrest, aneurysm. When to see a doctor. It's never too early to see a doctor to discuss your risk for heart disease. In fact, the new primary prevention guidelines say that the earlier the risk factors for heart disease are prevented or treated, the less likely you are to develop heart disease later in life. So, if you're concerned about your risk for heart disease, make an appointment to discuss how you can prevent this highly preventable condition. If you're having any symptoms at all, it's very important to discuss these with your doctor as heart disease can masquerade in many different ways. It's easy to dismiss many warning signs of heart disease like fatigue, indigestion, and shortness of breath as just a normal part of life or mild illness. But because a heart attack can happen suddenly, it's important not to ignore any potential warning signs. If you have any of the above symptoms of heart disease, especially if you also have risk factors, see a doctor.